Thank you, Ciara. Look, I too would like to welcome the Minister to the House back again this evening, a regular visitor to the House. I'd like to commend Senator O'Keefe on bringing the motion to the House, and I would like to second the motion. We've had many discussions, Minister, on the whole issue of mental health in the last 2 years, and indeed I must commend both you and the Government on the work that has been carried out, and as Senator O'Keefe has said, the promises that have been kept that were made before coming into government, and the promises that have been kept in the programme for government. I too would like to welcome the Mental Capacity Bill, which is presently before the other House, and welcome, and I know just even being at a briefing yesterday with members from Inclusion Ireland, how very welcome this is right across the board, and how vital it is that we give people the opportunities to make decisions where and when they possibly can, and that we're not making decisions for people when they're quite capable of making the decisions, or perhaps just need to be assisted. As I said, we've had debates before, Minister, on the vision for change, and we've had debates in areas. So I would just like today to just look at some of the things, or some of the areas that I would like to see improvements in it. The first one that I'd like to, and I do, is the whole area of the inpatient child and adolescent services. And where a Vision for Change recommends the provision now of 80 child and adolescent psychiatric inpatient beds, where there are currently 44 between Dublin, Cork and Galway, which I think, and I know I've raised it on many different occasions here, that I just don't think that's enough. I think we need to have more beds, and we need to have more availability of the beds. I know that there will be an improvement in this, but I also think that it's very important that children and adults are not mixed, and I know that the plan is, and I welcome that the plan is that will decrease, and it has decreased in recent years, but in my view, not quick enough and not fast enough. And I think that that's something, particularly in the area of 16 to 18-year-olds, I think there's a huge gap there. And I just know from talking with youth groups myself that this is, and people who are working with youth of this age, that this is a huge concern to workers both in statutory and in the non-statutory bodies, that this is going on. Also, I think the point that you brought up, Senator O'Keefe, about patients, and I think it's another very valid thing, is that patients, when they're going to see the doctors, that they're not seeing a different doctor every time they go to a visit. I think it's very, very important that continuity is kept, that when they go to see a doctor, be it the fact that, and I do understand that sometimes you'll have doctors in on rotation, but that continuity as much as possible is kept. The link I mentioned there between statutory and non-statutory bodies, I think, is very, very important. We have excellent work being carried out in the HSE. I know in my own area we've got St Bridget's, we've got Ladywell Centre out in the community under the HSE, who are doing excellent work, absolutely excellent work. The waiting lists are far too long. I think that's a problem that's all over the place, and something that does need to be addressed. I know that a new mental health service facility will be shortly available in the Lourdes Hospital in Drogheda. I would hope, and I would ask Minister here this evening, that won't encroach on the service that is already there in St Bridget's. That I think you've got to remember that when people are coming from one end of the county, that it can be a huge long journey for them to have to make that, to go up to the opposite end of the county. For people that are vulnerable, who are perhaps not able to do long journeys, or people who have become very, very used to where they're going, that be taken into consideration. the work of Corlin and Og, again, I too would like to pay a huge tribute to it, and I know that the Corlin and Og in Louth have done tremendous work in the whole area of, last year they produced an app, highlighting the services that were out there. And I think the young people that are out there now are absolutely amazing in bringing forth, and are much more forthcoming about speaking about their own mental health than, say, that we even are at this stage. And we do talk about the improvements that there have been to mental health and that people are coming out, but I think we have an awful lot to learn from the young people that are around. I do think it's very, very important that with the schools, and I think that's one of the things with the Vision for Change, where they have listed recommendations. They're not obligations, and people are not obliged to take it. So I think that we have to ensure that schools do take on the whole policies that are there on the mental health. And on suicide awareness, because if the schools don't buy into it, it's going to be lost. So where it's, I know that, as I said, it's a recommendation, I think we could go even stronger and ensure, like where we have, which is brilliant, we have anti-bullying policies now, and we have all different policies, we have our discipline problem, we need to have a mental health policy for each school as well. I think that's very important. If I could just mention briefly as well, in my own area, I think I've mentioned it to you before, just after Christmas last year, just a year ago, we had a public meeting in Dundalk calling together all the different agencies, statutory and non-statutory bodies, all the organisations that are around that were providing services for people, to promote positive mental health, because as I said, so often it's the... Thank you. I would just like to say, even from a personal point of view, how good it was for me to become aware of, the different groups, and I'm sure I'm going to leave lots of them out. But I mean, we have now formed a forum where once a month we deliver a talk, or somebody within the steering committee. I mean, everybody is involved, or any agency is involved, or group is involved in the forum. But within the steering committee, we have members from the organisation Shine, Grow, the Dundalk Outcomers, a member of the Garda Síochána, a member of the HSE, and suicide awareness groups within the Dundalk, a member of Corlin and Og. So we've got somebody from every kind of aspect, if you like, and delivered talks on it. But it's amazing the amount of information that each of us and each of the bodies that are there have fed into one another, who weren't aware of the service that the other was fully aware of the service that was being provided. And as I said, once a month we would have a talk, and this is included, on cyberbullying or suicide awareness. We did the SAFE talk, and every single person has come out. Just last Monday we did one on coping with adolescent anger, delivered by, which is a huge a huge problem now for a lot of young people who don't even realise that maybe what they're feeling is perfectly normal, and who become concerned with mental health, and think that they have a problem. But, these talks were all very well attended, and it's great. And I think, that doesn't cost money. There's no funding. We just meet to try and promote positive mental health. And I think that this is a very cost-effective, if you like, area where we can all help to improve the mental health services in our community. Thank you.
Senator McSherry.